Thank you for joining us on this busy Tuesday night. I'm Nasha Sherman.
And I'm Dan Schaefer. As you can see, we have a lot to get to tonight. We begin in our own backyard. Right now, there are more than 460 coronavirus inpatients across the Huntsville Hospital system. Nearly 100 of those are in the intensive care unit. More than 60 are on ventilators. And while hospitals are trying to deal with the spike in patients, what's making things even harder is the number of employees the virus is forcing out of work. Tonight, we know hundreds of Huntsville Hospital employees are out due to the virus.
WAAY 31 Sophia Borelli joins us live from Huntsville Hospital. She has details on the very concerning numbers we learned about today. Sophia.
We know that there are more than 300 Huntsville Hospital healthcare system employees across the network that are out because they either have the virus or they have been in close contact with someone who has had the virus. We also learned today that Huntsville Hospital posted close to 400 online wanted ads in November, according to the Alabama Department of Labor. Dr. Pam Hudson, the CEO of Crestwood Medical Center, says that if the community doesn't help to stop the spread, that care as we know it could change.
Today, we have people waiting to get into hospital beds because we don't have quite enough staff to accept them up onto the units.
Dr. Pam Hudson, the CEO of Crestwood Medical Center, says that there is a significant shortage of healthcare workers to staff hospitals in our area.
Over 180 county and 350 area employees that work at the hospitals are unable to work right now due to either their own illness or because of illness in their family or close contacts that have resulted in their quarantine.
She says because of this, frontline workers are stretched thin.
Nurses and other staff members working in departments that they don't normally work in. It has caused most facilities to revise their routine care schedules in taking care of patients.
Commission Chairman Dale Strong agrees.
This virus is directly impacting those who provide the care to this community, nurses in our hospitals, physicians, and first responders. We cannot afford to lose the caregivers and healthcare professionals who provide the care we need, and especially for the critically ill with coronavirus.
Dr. Hudson says that if people in the community do not help in stopping the spread of the virus, your healthcare could be impacted.
You run into some issues with care that's not able to be what we have come to know and appreciate in our healthcare system.
She says as a community, we can help by wearing your mask, social distancing, and sanitizing.
We can't afford to have that many people out because our work saves lives and takes care of people and helps prevent more complications. So that absence of workers is really the issue, and to fix that, we need to drive down the community transmission.
Local leaders are also worried about the spread of the virus as people get together for this upcoming holiday season, and so they are asking and stressing if you do gather to have small gatherings this holiday season. Live in Huntsville, Sophia Borelli, WAAY 31 News.